Hi, and welcome to the next video in the Maternal Health webinar series presented by Security Health Plan. In this segment, we'll define health disparities, explain their causes, and provide important data. Let's get started. According to the Center for Disease Control, or the CDC, health disparities are preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by socially disadvantaged populations. Socially disadvantaged includes marginalized populations that are defined by race, nationality, gender identity, sex, sexual orientation, age, disability, socioeconomic status, or geographic location. What are some factors that contribute to health disparities? They may include poverty, environmental threats such as air pollution, mold, overpopulation, and climate change, inadequate healthcare access, education inequity, and geographic locations such as rural versus metropolitan areas. Health disparities are a direct result of the inequitable distribution of social, political, economic, and environmental resources when the American healthcare system was originally founded and throughout its lifetime. Social determinants of health, or SDOH, are the conditions in the environments where people are born, live, learn, work, play, and worship that affect a wide range of health, functioning, and quality of life outcomes and risks. They include the 5 following domains: healthcare access and quality, neighborhood and built environment, social and community context, economic stability, and education access and quality. Social determinants of health contribute to a wide health disparities and inequities, including those in maternal health. For example, people who don't have access to grocery stores with healthy foods are less likely to have good nutrition. That raises their risk of health conditions like heart disease, diabetes, and obesity, and even lowers life expectancy relative to people who do have access to healthy foods. Conditions such as these can increase one's risk for pregnancy complications and poor birth outcomes. Social determinants of health affect everyone, but they intersect with social identities including race, ethnicity, gender identity, and sexual identity to further the impact of health disparities. There are specific health disparities as it relates to pregnancy, labor, delivery, and postpartum experiences, and different groups of pregnant people are more at risk for conditions like preterm labor and birth, pregnancy-related death, infant mortality, stillbirth, anemia, asthma, low birth weight, stress, high blood pressure, neonatal death, preeclampsia, and mental health conditions. This does not mean that just because you are Black, low income, or disabled, for example, that you will automatically have these conditions if you choose to be pregnant. All it means is that aspects of your life, which are a result of your social identity, cause you to be more at risk for some of these conditions, and you may have to work a bit harder for them not to occur. For example, as a Black person, you are more likely to face race-based discrimination on a regular basis. This increases levels of stress, which can then increase your blood pressure, leading to preeclampsia. Therefore, Black pregnant people are more likely to have preeclampsia. It has nothing to do with race itself and more to do with how society is set up against non-white people. Disparities can present in many ways, including who gets adequate prenatal care. Among Black, Indigenous, and people of color, or BIPOC, those living in areas of high poverty can have a 62% increased likelihood of inadequate prenatal care when compared to those living in areas of lower poverty. Asian/Pacific Islander women living in areas of high poverty are 1.4 times more likely to receive inadequate prenatal care compared to those in areas of lower poverty. In 2020, approximately 900 people died in the U.S. from causes related to or worsened by pregnancy. Pregnancy-related deaths are deaths that occur within 1 year of pregnancy. Indigenous and Black people are more than 3 times as likely as white people to experience a pregnancy-related death in 2020. Hispanic people also have a higher rate of pregnancy-related deaths compared to white people. Research shows that these disparities increase by age and persist across education and income levels. Data shows higher pregnancy-related mortality rates among Black women who completed college education than among white women with the same education and white women with less than a high school diploma. Similarly, research finds that high-income Black women have the same risk of dying in the first year following childbirth as the poorest white women. Other research also shows that Black women are at a significantly higher risk for preeclampsia, which is significantly more common than maternal death. Maternal mortality and pregnancy-related mortality are similar concepts, but maternal mortality is a narrower measure limited to deaths that occur while pregnant or within 42 days or pregnancy, and excluding those due to accidents or acts of violence. However, more recent maternal mortality data are available, allowing for examination of trends since COVID-19. Black women had the highest maternal mortality rate across racial and ethnic groups between 2018 and 2022, and also experienced the largest increase during the pandemic. Maternal mortality rates decreased significantly across most racial and ethnic groups between 2021 and 2022. This decline may reflect a return to pre-pandemic levels following the large increase in maternal death rates due to COVID-19 related deaths. Despite this decline, the U.S. has the highest maternal mortality rate among high-income countries, and the maternal mortality rate for Black women has remained over 2.5 times as high as the rate for white women. Among births in Wisconsin during the 2021 to 2023 period, 7.9% of infants were considered to have low birth weight, below 5 pounds 8 ounces. 10.1% were born preterm, meaning an infant born prior to 37 weeks of gestation, and 9.5% required specialized medical care and were admitted to neonatal intensive care units, or NICUs. During the 2021 to 2023 period, persons who identified as Black who gave birth experienced the highest rates of low birth weight in preterm births. Persons who identified as white who gave birth experienced some of the lowest rates. During the years 2021 to 2023 in Wisconsin, preterm birth rates were highest for Black infants, 15.4%, followed by Indigenous infants, 14.7%, then Hispanic infants, 9.9%, then white infants, 9.3%, and finally Asian/Pacific Islander infants, 9%. Black infants were about 2 times as likely as Asian/Pacific Islander infants, 9%, to be born preterm during 2021 to 2023. Being aware of maternal health disparities is crucial because it allows you to advocate for yourself, seek equitable care, and recognize potential biases in the healthcare system. We hope knowing these disparities exist will ensure you receive the safest, most respectful care possible, no matter your background or circumstances. In our next maternal health video, we'll talk about how to advocate for yourself throughout your pregnancy. We'll help you understand self-advocacy, the importance of a solid care team, and support people, and what steps to take to self-advocate. If you have additional questions, please reach out to your provider or call Security Health Plan at 1-800-472-2363. Thank you.